Hello everyone, my name is Dr. Karin Vieten. I'm a clinical epidemiologist.
Hello everyone, my name is Dr. Linde Nijhoff. I'm health psychologist and specialized in chronic fatigue in patients with a chronic medical condition.
We're very happy to announce that the data we will be discussing here has just been published online in the Journal of Allergy and Clinical Immunology in Practice. So please check out our article on their website. It's open access, so it's available to everyone. And you can also access it in the description of this video.
In our patient population with severe asthma, fatigue is a major concern. Often patients arrive exhausted when they come in a Dutch asthma center in Davos in Switzerland and are limited in their daily function. It's a frequent reported extrapulmonary trait in some studies, but often overlooked as an outcome in trials. There's limited data on the prevalence and impact of fatigue, especially in severe asthma. Fatigue can be defined as a persistent, overwhelming sense of tiredness, weakness, of exhaustion, resulting in a decreased capacity for physical or mental work.
So alpine altitude climate treatment provides a multidisciplinary pulmonary rehabilitation approach and is specifically suitable for patients with uncontrolled severe asthma. It has been provided in Europe for decades. The Dutch Severe Asthma Clinic is a small rehabilitation clinic where around 120 patients per year are treated. The main goal of this type of treatment is to optimize asthma control and daily functioning and to improve quality of life. Alpine altitude climate treatment starts with a multidisciplinary assessment week, where all contributing factors and treatable traits are identified. This is followed by a multidisciplinary treatment strategy with pulmonologists, health psychologists, specialized respiratory physiotherapists, specialized nurses, dietitian, social workers, and the total treatment duration is usually 8 weeks. If you want to know more about this type of treatment, I would like to refer to our position paper that has been published in Allergy in 2022. So basically, there are 3 possible working mechanisms identified. The physical characteristics of moderate altitude, which are less relative humidity, lower temperature, higher UV radiation, lower barometric pressure, lower air density. Then there are the environmental characteristics of the alpine climate, which are low allergen exposure and less air pollution. And this is combined with a personalized multidisciplinary rehabilitation program for several weeks. We set out to do a retrospective observational study to assess the prevalence of severe fatigue in patients with severe asthma. And we wanted to know which factors are associated with fatigue severity. Then we wanted to know the effect of our treatment program. So we assessed the impact of multidisciplinary pulmonary rehabilitation in the alpine altitude climate on fatigue, but also on other asthma outcomes. And then as a last step, we wanted to identify factors that contribute to persistent severe fatigue. So we designed a retrospective observational study and included patients with severe uncontrolled asthma that were referred from the Dutch pulmonologist to our specialized asthma clinic for alpine altitude climate treatment in the time period from 2007 to 2018. In our multidisciplinary systematic assessment, we included clinical, inflammatory, functional, and psychological characteristics. In the time period between 2007 and 2018, there were 1,098 admissions. However, some patients came multiple times in this time period, and we only included the first admission, leaving us with 502 patients. Some of them had incomplete questionnaires and were excluded, so in the final data analysis, we have 420 patients. 70% of the patients were female. The median age was 45 years, 71% had an allergic asthma, FEV1 was 91%, Asthma Control Questionnaire median score was 3, AQOQ was 4, and sinonasal outcome score was 47. 52% of the patients were taking daily oral corticosteroids, and severe fatigue in this population was 91%. We assessed the fatigue with the CIS fatigue, which is a Dutch measurement a validated measurement to assess fatigue. And a score of more than 36 is the cutoff for severe fatigue. We conducted a multivariable regression analysis to assess the association between several factors and baseline fatigue severity. In this figure, you see all the assessed contributing factors from a multidimensional systemic assessment. They are displayed in a white square. Significant predictors according to the univariable models are displayed in the outer white circle, while the significant predictors from the multivariable model are in the purple circle. So we found out that fatigue severity at baseline correlated with less asthma control, more sleeping problems, female sex, lower FeNO, and gastroesophageal reflux disease. These factors were on baseline associated with fatigue severity.
Regarding fatigue, severe fatigue was reported by 91% of the study population. 73% of patients showed resolved fatigue after 12 weeks of treatment, while 27% of the patients remained with persistent severe fatigue. In this treatment, there was not a specifically focus on treating fatigue.
If we look at other asthma outcomes, we also notice that patients with persistent severe fatigue demonstrate less improvement on the other asthma outcomes. If you look at the first graph, you see the improvement in asthma control, which is significantly less for the patients with persistent severe fatigue. The same goes for the use of daily oral corticosteroids, the asthma-related quality of life, the 6-minute walking distance, which is a measure of physical fitness. Regarding lung function and FeNO, we see no differences in improvement between the two groups. Our multivariable regression analysis showed that 4 variables assessed at baseline independently predicted persistent severe fatigue after rehabilitation. Sleeping problems, the use of maintenance daily oral corticosteroids, more severe fatigue initially, and older age. In this figure, you can see all the assessed contributing factors in the white square. The significant predictors according to the univariable models are displayed in the outer white circle, while the significant predictors from the multivariable model are displayed in the purple circle. This is the first major cohort study that investigates severe fatigue and the impact of pulmonary rehabilitation on fatigue and severe asthma. Severe fatigue and severe asthma was highly prevalent, 91%, which is 1.5 times higher than the general asthma population. We found that multidisciplinary rehabilitation in the alpine altitude climate results for most patients in recovered fatigue and also improved asthma control for the majority of patients. However, there's a small subgroup of patients who remain with persistent severe fatigue. We found that sleeping problems and maintenance oral corticosteroid use are important predictors for persistent severe fatigue. For the future, we still have to investigate whether addressing fatigue and sleeping problems with specific targeted treatment strategies, such as, for example, cognitive behavioral therapy, results in better asthma outcomes. We also included some references which we think are valuable if you want to know more about severe asthma and severe fatigue. So thank you so much for listening to our presentation.
Thank you very much.